Hello, my name is Danielle Lewis, and today I will be presenting on borderline personality disorder. Borderline personality disorder is a mental health disorder that impacts how an individual thinks and feels about themselves and others. It causes problems in functioning in everyday life because it causes people to have a hard time regulating their emotions. Once an event triggers their emotions, it is hard for them to return to a stable place emotionally. They tend to view things in extremes as either all good or all bad, which can cause their opinions of other people to change very rapidly. Borderline personality disorder begins in early adulthood, and it is estimated that about 6% of the United States has this disorder. Verywell Health says that there are 4 types of borderline personality disorder. They are petulant, discouraged, impulsive, and self-destructive. While there are different subtypes of borderline personality disorder, there are also general signs and symptoms of the disorder. A person with borderline personality disorder may have an intense fear of abandonment or instability. And the fear could be real or it could be imagined, but even if it's imagined, it feels very real to them. They can see rapid changes in self-identity and self-image. They can have shifting goals and values, can see themselves as bad or non-existent. They may see periods of stress-related paranoia and loss of contact with reality or dissociative feelings that can last from minutes to hours. They often have impulsive and risky behavior. They describe feeling empty. They can sabotage their own success by doing things like ending a job a good job with no real reason, or ending a positive relationship. They often have self-harm behaviors or suicidal threats, mood swings, and can become very angry when not warranted. Petulant borderline personality disorder can cause a person to feel unworthy and unloved. That, matched with an unhealthy desire for control, can lead to relationship challenges. These challenges often lead them to be dissatisfied with their relationships. Some behaviors common amongst people with petulant type borderline personality disorder are manipulation, irritability, impatience, stubbornness, defiance, passive aggressiveness, and severe mood swings. They may swing without notice between one emotion to another, like angry one minute and happy or sad the next minute. Discouraged type borderline personality disorder is sometimes called quiet type borderline personality disorder. And with this type, they have a fear of abandonment, and they will do anything, take extreme actions to avoid abandonment, whether real or imagined. Where with other types of borderline personality disorder, people often blame other people for their problems. With this type, they actually tend to self-blame. Signs and symptoms of this type of borderline personality disorder include clinginess, codependency, neediness, emotional mood swings. If their abandonment issues are triggered, they often become very angry or emotional. People with discouraged type borderline personality disorder are often perfectionists, highly successful, high functioning. They can feel alienated or detached when they're in groups, or feel like their bonds with other people are not real or not strong. They often seek approval, self-isolate, self-harm, or just they feel lonely. People with impulsive borderline personality disorder tend to be charismatic, energetic, elusive, or detached. They might be flirtatious and engaging or motivating. People with impulsive borderline personality disorder often display binging behaviors like binge eating or overspending. They often partake in risky or self-destructive behaviors like unprotected sex, sex with multiple partners, driving under the influence, substance abuse, or gambling problems. And they often display aggressive behaviors like outbursts, physical fights, breaking things, hitting things, or having yelling fits. People with self-destructive borderline personality disorder often feel self-hatred or bitterness towards themselves, and other signs and symptoms are similar to that of a manic episode. They can have increased energy with a decreased desire to sleep, and they can have euphoria. They may have substance abuse problems that include recreational or prescription drugs. They often partake in adrenaline-seeking activities without properly preparing for them, which can cause them to get hurt. They may display self-harm behaviors like cutting, burning, scratching, or hitting, and they may threaten suicide. Risk factors of borderline personality disorder include genetics, having a family member with the disorder, or a stressful childhood. And stressful childhood isn't just talking about the normal childhood stressors. It's talking about being sexually or physically abused or neglected as a child, being separated from a parent at a young age, having a parent or caregiver with substance abuse problems or other mental health disorders, and being exposed to hostile conflict or unstable family relationships. The exact cause is not completely understood, but they believe that causes can include environmental factors like childhood abuse, genetic factors like family members having the disorder or a similar disorder, and brain abnormalities, including when parts of the brain do not form properly, the parts of the brain that are involved in emotion, regulation, impulsivity, and aggression, or when the brain chemicals that regulate mood don't function properly, mainly serotonin. Borderline personality disorder can lead to other mental health disorders like depression, alcohol and substance misuse, anxiety disorders, eating disorders, bipolar disorder, PTSD, and other personality disorders. People with borderline personality disorder often see damage to areas of their life. Frequent job changes or losses, not completing their education, multiple legal issues including jail time, conflict in their relationships, or having abusive relationships, self-injury and frequent hospitalizations, attempted or completed suicide, and consequences of impulsive or risky behavior like unplanned pregnancy, STDs, vehicle accidents, and physical fights. There are no medical tests to diagnose a person with borderline personality disorder. Instead, it's diagnosed like many other personality disorders through a detailed interview with a medical provider that includes a psychological evaluation. You and your family members might have to fill out questionnaires. They will look at your medical history and your exam and have a detailed discussion of your signs and symptoms. Diagnosis is made in adults. They will not diagnose a child or a teenager with borderline personality disorder because symptoms in a child that may appear to be borderline personality disorder can go away as they age and become more mature. Treatment of borderline personality disorder requires time, patience, and commitment. The main treatment is psychotherapy. A doctor sometimes will prescribe medication, but there are no FDA-approved medications for borderline personality disorder. Instead, they give medications to treat symptoms or co-occurring problems. These include antidepressants, psychotics, and mood stabilizers. Doctor will suggest hospitalization when they feel you're at risk of self-injury. Putting you in the hospital allows them to have a more intense treatment and protect you from self-injury. The main type of treatment is psychotherapy, which is sometimes known as talk therapy. And there are many types. It can be dialectical behavior therapy, schema-focused therapy, mentalization-based therapy, systems training for emotional predictability and problem solving, which is also known as STEPS, transference-focused psychotherapy, which is also known as psychodynamic psychotherapy, and good psychiatric management. The goals that psychotherapy helps with are to focus on the current ability to function, learn to manage emotions, reduce impulsiveness, improve relationships. Borderline personality disorder is a mental health problem that impacts how an individual thinks about themselves and others. It's not diagnosed until a person is an adult. An estimated 6% of people in the United States have borderline personality disorder. There are 4 subtypes of borderline personality disorder: petulant, discouraged, impulsive, and self-destructive. A person can have one or multiple of these subtypes. The cause of borderline personality disorder is not completely known, but it is believed that environmental factors, genetic factors, and brain abnormalities can all play a part in it. Risk factors include genetics and multiple stressors in childhood. Complications include mental health disorders and damage to areas of the patient's life. They're not medical tests, and diagnosis involves a detailed interview with a medical provider. Main treatment for the disorder is psychotherapy, but medication can be used to treat symptoms. Thank you for watching my presentation. Have a good day.